So the question is, if you are potentially at the start of this journey, then how can you evaluate the opportunity for social and green prescribing, and then I suppose monetize it is probably the wrong word, but express it to your leaders to be able to put some resources behind it.
And Richard's from an NHS trust, so it'd be quite interesting to answer this from a community perspective, but it might be quite interesting to think about it, about how hospitals could use their green space as well. So maybe that puts a different flavour on it, and maybe that's not your remit, but just throwing you a curveball there.
Well, the outer institutions work, I think, is really relevant in terms of the trust as well, and connecting it up with the other things that you're trying to do. And we are saying to our colleagues who are leading on that, it would be helpful to do a little joint comms. So we might come back to you for some ideas on that. But in terms of evaluation, I think what I would say is there is a lot of evidence out there already about how green social prescribing can improve the health and well-being of individuals, and we can help to share that, Olivia, because I think it's important to sort of acknowledge we're not starting from scratch here. There's a lot that we can demonstrate already, and key things that need to be taken into account to make sure that it does work. So that's something, Sam, I think we can look at in terms of how we're sharing the evidence. And then I think it's one of the things that the test and learn sites will be doing is identifying what are the key or really useful outcome measures that would be useful to you. So from a generic social prescribing perspective, at NHS England, we talk about ONS4, but there's a whole range of others, such as WEMWebs that people use, such as STAR, the outcome STAR. There's a whole range of things. Jane and Jenny and others will talk about things that people use. So I think the thing that I would do is identify what's essential to capture, and don't do any more than that, because I think one thing Jenny made a point about that's really important is that it's quite hard after somebody's done an activity to then give them a questionnaire to fill in, and if it's too much, it can really switch off participants, and it stops normalizing the process of having a walk in the countryside or doing a bushcraft activity. So I think you have to be aware of what's out there already to demonstrate impact, and then what are the few key measures you could use to really show. So it depends on the change you want to see, really. If it's about improving people's mental health outcomes, then there'll be particular measures. If it's about improving people's social connections around it might be the loneliness measure. There's a whole range of different measures. So I think be clear what the problem is, or look at the research already, identify what's the problem you're trying to solve and what would be the relevant measures for that, and then we'll try and share some of the best practice from the site. So I think we're going to be communicating something quite quickly about what they're doing now, and then each 6 months do a little bit of an update. So I don't know, Jane and others, whether you want to come in, or Sam, about measures that you're coming across that are useful.
Yeah, I just wanted to add something about one of our plans that we're sort of fleshing out at the moment, alongside, as you say, Nick, these sort of measures that are out there that we certainly use, and others will be using as well, but also looking at using things like storytelling methods to go and actually not so much collect case studies, but actually really do a deep dive into why somebody came through the green social prescribing referral pathway in the first place, what happened when they engaged in the green activity, and what sort of impact that it's had on them, and actually bring those stories together into a sort of discussion day with the partners that we're working with locally, and really see if we can't begin to sort of build a picture of what's going on for local people in their local community. So that's one of the things that we're looking at doing. I suspect that what Richard is really interested in, and correct me if I'm wrong, is perhaps how can we measure the impact that green social prescribing and social prescribing is going to have on our health system, and when are we going to begin to see a sort of a bit of a release on the pressure in those services. And I think that's a challenge for all of us to be able to begin to measure and evaluate, if you like, the sort of monetary benefits of social prescribing. And I don't think that's the sort of thing that we're going to solve overnight, but I think the green is actually a really good focused way of looking at that issue.
Yeah, the social prescribing technical guidance on the NHS website does sort of set out an outcomes framework, which can be quite helpful to have a look at. We've also, the National Institute of Health Research has just commissioned for the Department for Health and Social Care a national evaluation of social prescribing in the NHS. So that will, social prescribing link workers, if you like, that will be, and we've asked for that to provide iterative learning as we go, so that people can use those outcomes. And we've got this green social prescribing program, which I think is going to be really helpful to pull out key indicators here. But always happy to speak to people and connect you up with our evaluation and impact people at NHS England.
That's a great offer. Thank you, Nick. And yeah, Richard, do let me know if you want me to link you up. Yeah, I mean, because I think this area is so different from a lot of work that we've done in hospitals sometimes, which might be, swapping from one anaesthetic method to another, which is much easier to quantify in stuff. What we find harder is looking at the cultural change and social change, and I think which is an area that we want to get more competent on, not just for patients, but also how sustainable healthcare changes, happen cultural-wise, which is something what Jacob was referring to. And I think this sort of, it's wonderful having some work going on in this area to help us to build capability in that.
And I thought Jacob pulled out something quite interesting, Olivia and Jenny, about the benefits for staff as well as for individuals. So I think, there's a big link to improving the health and well-being of our staff as well, when they're enabled to participate in supporting people in green activities.
Indeed, yeah, absolutely. But I think that's a lovely thought to end on, actually. I'm just going to, I think if we draw the panel discussion together, and just thank you all so very much, each of you. Thank you, Nick. Thank you, Jenny. Thank you, Sam. Thank you, Jane. Obviously, thank you to Jacob as well, who's not here, for just sharing very generously your expertise in such an engaging, enthusiastic way. That has been wonderful to host you, and I've certainly enjoyed the conversations that we've had leading up to this. It's been a real pleasure, and we'll look forward to keeping in touch, and I hope other people have found it helpful, and we'll be keeping in touch as well with your progress on your different programs. So thank you.